Are we ready to, everybody ready to go? Well, good morning, everyone. Last week, Dr. Morrison and I spoke about our concern with the rising COVID-19 cases across the country. As we all know, we've seen rises in every single province across the country, and the daily case load has hit an all-time high, it seems, every day. Particularly over the last 72 hours, we have started to see that in the Atlantic region as well. Yesterday, on a couple of different occasions, I spoke to my fellow Atlantic premiers, and we all agreed that it was important and that we would all monitor the situation closely within our provinces and take all necessary precautions in our own respective provinces to keep our residents safe. And it is for those reasons that we, as Prince Edward Island, have decided to temporarily suspend all non-essential travel to and from Prince Edward Island, meaning we would be suspending our participation in the Atlantic bubble for a 2-week period. These additional measures will take effect starting at 12:01 a.m. Tonight for a minimum of 2 weeks until Monday, December 7th at midnight, and we will reevaluate at that time based on the best information and the epidemiology that we have at that time. Like all of the decisions that we have made collectively and in the best interest of keeping Islanders safe and healthy, this has not been an easy one for us to make. I don't believe it is a step backwards for us, even though we know it is a tough measure. I feel it is a proactive measure. I feel it is a preventative step and a preemptive decision, which we hope will allow us to maintain the level of almost ordinary life that we have been enjoying in this province. As we all know, our students are in school. We're able to go into restaurants to eat. We can go to gyms and sporting events, and we are doing many, many things in this province that other jurisdictions in the country are either not able to do or have begun to scale back upon. So we make this decision today with the hope, as the COVID cases are increasing all over, that this is an extra layer of caution, and it will continue to allow us to maintain what we have here. Again, I see this as a temporary measure. We will review this after 2 weeks and see what the lay of the land is, so to speak. We will monitor the region. We will monitor the country with the hopes that we can, break the back of this virus one more time. I also feel that even though we are moving backwards in terms of where we are at going back to June, I feel it is much different now. I do feel like we can see the finish line when you look at the very positive news of vaccine production, etc. So I feel we're in a different headspace and a different place than we were back in the spring. And I do feel that if we can take these measures and act accordingly, it is our hope that we can break the transmission chain in the country and the region and start to get back on the road to where we all want to be. The risk to our province from an infection standpoint has always been from the outside. All of our cases have been imported through travel. And I think it is important to note that even though we are seeing escalation in the region, none of our cases to date have come from the bubble. But when we look at what we're seeing now, when we look at the epidemiology, we know that things are changing. When we see increases in every single jurisdiction, there's a heightened level of concern that it brings. And it forces us to use what I believe are the tools in our limited toolbox to do everything we can to avoid an outbreak here in PEI, and utilizing our borders as a province, as we have done earlier in the COVID situation, is one of those tools. Our worry with COVID from the beginning has been our size. We have a health system that is strong and that is ready, but we also know that it has limitations. And the potential of a large outbreak, as we have seen in other jurisdictions, would put pressures on our system, and we could very easily become overwhelmed. And that is what we've been trying to avoid all along. So we want to try to continue to avoid that, and that is why we are announcing these additional measures today. I would just say that I know this is hard. I know it is disruptive for families, for businesses, for individuals. And we don't come to these decisions without that knowledge. But this is a decision that we need to make to keep us healthy and to keep us safe and to keep this life that we have enjoyed, that we have earned here in Prince Edward Island, that has made us the envy of other jurisdictions in the country. So with that, I will pass it over to Dr. Morrison for her daily update and some more information around the measures that we will be enacting today and how they will be rolled out. So,
thank you, Premier. Good morning, everyone. There's one new case of COVID-19 to report in PEI today. The individual is a female in her 40s who's traveled to PEI from outside the Atlantic bubble. She is self-isolating and contact tracing is underway. There are currently then 2 active cases in the province. Since the pandemic started, there have been 69 cases of COVID-19 in PEI, and all our cases, as the Premier mentioned, have been related to travel outside the bubble. Across the country, jurisdictions are struggling with the second wave of COVID-19 over the last number of weeks. We continue to see case counts rise exponentially in provinces and territories, with records for daily numbers of new cases being shattered day after day. And we have seen how quickly health systems get overwhelmed. We are seeing drastic measures being implemented to limit the spread of COVID-19 in communities. And until recently, our region in Atlantic Canada was doing very well with relatively low numbers of new cases of COVID-19 with small, manageable clusters and outbreaks. But over the last number of days, it has become apparent that our neighbors in Atlantic Canada, especially Nova Scotia and New Brunswick, are experiencing a second wave of COVID-19. New Brunswick has 77 active cases, Nova Scotia has 44 active cases, and Newfoundland and Labrador 21. Not all of these cases are related to travel, meaning there is evidence of community spread. It's actually likely that PEI will have cases related to the exposures and outbreaks currently underway elsewhere in Canada. So in other words, I am concerned that it may already be here in some people. But we know that by the time there is a large COVID-19 outbreak in the community, it is too late, and that it will likely have already spread. So we need to act fast. I've said before that COVID-19 is knocking at our door, and in recent days, that knocking has become louder and stronger. While we recognize we cannot reduce the risk to zero, it's important that we take reasonable steps to lower the risk of importation of COVID-19 into PEI. It's important that we protect islanders from COVID and protect our health system from being overwhelmed. We want to be able to continue, as the Premier mentioned, to go to restaurants. We want our children to attend school, to attend church. We want our businesses to remain open and for our economy to continue to function. As I noted last week, islanders should only leave PEI if it is absolutely necessary, such as for work or for a medical appointment. Only travel off island if it is for essential purposes or work. Now is not the time to travel within Atlantic Canada for non-essential purposes, such as shopping or a casual visit with family or friends. So we are announcing that effective Tuesday, November 24th at 12:01 a.m., PEI's participation in the Atlantic bubble will be suspended for 2 weeks, at least until December the 7th. Beginning tomorrow, all people who travel to PEI will be required to self-isolate, or they can apply to work isolate for 14 days. Non-island residents will be required to apply for pre-travel approval prior to coming to PEI, including a 14-day self-isolation plan. People coming to PEI to do essential work will continue to be eligible to work isolate. Island residents will be required to self-isolate or apply to work isolate for the 14 days after returning to PEI. This means that island students studying off island will be required to self-isolate for 14 days when they travel back to PEI. Individuals will still be able to continue to travel to PEI for compassionate purposes and custody arrangements. People will be able to attend off-island medical appointments, but there will be no interprovincial tournament play in Prince Edward Island. People who need to travel within Atlantic Canada for essential purposes, medical appointments, transportation of goods, pickup of students at university, and they return to PEI within 24 hours, will not be required to self-isolate as long as they follow certain measures and enhanced infection prevention control measures during that period of time. Rotational workers, including truck drivers, who travel exclusively within Atlantic region will, like our other rotational workers, be required to register with our office as rotational workers. However, for the next 7 days, they will not be required to follow the testing regimen, and this grace period will allow time for individuals to register with our office, and in turn, it will give staff time to determine the demand for additional testing related to this change. But if any rotational workers have signs or symptoms of COVID-19, they should arrange to be tested. Similar to other rotational workers, these individuals will be able to spend time with their families, but should avoid all other public places, wearing a mask when not at home, and arrange for contactless pickup of essential items. I urge all rotational workers traveling to PEI from within Canada and internationally to be very cautious and follow the public health measures. And we need the full cooperation of everyone who travels. Their individual actions can protect Islanders from the importation of COVID-19. In order to support this transition, for the next week, there will be limited discretion at all points of entry. Border screening staff will work with individuals traveling within the bubble who have not yet received pre-approval travel or work isolation approval. I also urge all individuals who have traveled within Atlantic Canada within the last 7 days to take additional precautions. They should take precautions for a total of 14 days from the time of potential exposure. Anyone who has returned from Nova Scotia or New Brunswick in the past week should wear a mask at all times when at work, school, or in a public place. They should limit close contacts with anyone outside their household and maintain as much physical distance as possible. They should pay extra attention to hand and surface hygiene and monitor themselves closely for symptoms of COVID-19 and arrange to be tested and self-isolate if symptoms develop. It is critically important that people arrange for testing at the first signs of any symptoms of COVID-19. Children who return from recent travel to these areas should not attend organized events such as hockey, dance, or ringette, or birthday parties or playdates for this period of time. Individuals can go to work or school with the understanding they adhere to the enhanced public health measures. It is important that Islanders who recently returned from travel within Atlantic Canada to take these extra precautions to protect themselves, their families, and the community. There is a growing list of public exposures in Nova Scotia and New Brunswick, and the link will be on the website. Anyone who has been at any of these locations at the specified times should go to be tested regardless if they have symptoms or not. They need to pay extra attention to public health measures, including wearing a mask at all times when outside their households, and not attend any public events, including sports, recreational activities, and church. In order to protect our seniors in long-term care who are particularly vulnerable to COVID-19, any long-term care or community care staff who travel off-island, including within Atlantic Canada, will not be eligible to work isolate. Out of an abundance of caution, partners in care who have returned to PEI from any jurisdiction in the last 7 days and going forward must be tested before visiting their loved one in a long-term care or community care facility. I urge all Islanders to keep their social circles small. We know that COVID-19 moves as we move, so smaller circles are better. My sincere thanks, as always, to Islanders for their continued support and willingness to adhere to the public health basics. Masks became mandatory in public places last week, and Islanders proved they are certainly willing to comply. I've heard of extremely high levels of compliance across the province. As one Islander wrote to me yesterday, he said, "I know most Islanders are willing to do this for safety." And there's no perfect recipe as we go through this, and these are tough decisions. But I do feel the end is in sight, as the Premier mentioned, with vaccine arrival due sometime in the new year. The changes announced today are not forever, but just for the time being, especially the next 2 weeks, and we will keep evaluating this. And together, we can do it. And as we double down our efforts to fight COVID-19, as we finish every time, please continue to be kind and please continue to be patient. Thank you.
Thank you, Dr. Morrison. We will now turn it over to some questions from our friends in the media.
Adam Hurst, New Brunswick Telegraph and Journal.
Hi there. Thanks for taking our questions. Premier King, talk a little bit more about what was discussed between the premiers on the weekend. And is this a unanimous decision that all 4 provinces will take?
Thank you very much for the question. We talked just about the increasing numbers that we are seeing across the country, that we are seeing within the region, and the importance for each one of us in our own jurisdictions to do what we can to try to limit that. We talked a lot about, discouraging non-essential travel across borders. And from our understanding from our public health office and the conversations they've been having on a national level, I think that's going to be a national conversation as well in the days ahead, if not today. So that was the level of the conversation. We just, as a province, have the ability, such as Newfoundland, to contain our borders a little bit probably more easily than some other jurisdictions. And as I said, it's a tool in the toolbox that we need to use. We think it's the best time to use it to try to limit the spread here in PEI and hopefully do the best we can to keep it out. But I think every premier in Atlantic Canada and across the country is trying to do everything they can to keep us safe.
Just as a follow-up, to clarify, New Brunswick and Nova Scotia don't look to take this decision. And just further, is this about getting things back to a bubble by Christmas, or what's the goal?
Look, I mean, I can only, and I don't mean to avoid your question, but I can only speak on behalf of the government of Prince Edward Island because that's what I'm elected and obligated to do. We are taking these measures because, first of all, because we can, and because we feel it is the best decision that we can make right now as a preemptive measure to continue to allow islanders to enjoy the level of what I say is almost ordinary life that we've been enjoying here in Prince Edward Island. And I think every jurisdiction, every premier has to make the decisions based on their own situations and what they want to do. And I don't speak for any one of them. I just need to do what I can do here in Prince Edward Island to try to keep us safe, following the epidemiology, following the advice of the Chief Public Health Officer. We have done that from day one, and it has served us well, and it would be poor for me to start to go against that. So that's where we're at today. It is my hope that this is a short-term measure. I think we see, I think we see the finish line here. This isn't a decision back in March where we don't know what's coming. We think this can be a temporary situation, but like everything we have done, we will reevaluate on a daily basis. We will base it on the best public health information that we have at the time, and we will reevaluate on December 7th.
Thank you.
Julien Lecacheur, Radio-Canada.
Bonjour, Dr. Morrison. Bonjour, Premier. Je voudrais savoir, en français, Dr. Morrison, pourquoi aujourd'hui, pourquoi c'était le bon moment pour mettre fin à cette bulle atlantique aujourd'hui. Il ne fallait plus attendre, selon vous, c'était maintenant ou jamais.
Bonjour, Julien. Je ne sais pas si vraiment toujours un bon moment exact qu'on connaît, mais on voit le nombre de cas et beaucoup de transmissions communautaires dans les régions de la Nouvelle-Écosse et Nouveau-Brunswick. Alors, on a la chance ici à l'île du Prince-Édouard de peut-être avoir encore un espoir qu'on peut protéger les insulaires. Et on doit faire notre mieux d'en faire. Alors, si on peut mettre en suspension vraiment la boule atlantique pendant un bout de temps, et ça nous aide à contrôler la transmission communautaire ici et les cas de COVID. On aimerait le faire et puis on doit faire avant que c'est partout dans la communauté. Alors, c'est vraiment, j'espère qu'on fait au bon moment, mais on voit les cas Nunavut, Colombie-Britannique et les provinces atlantiques et les nombres augmentent. Et on doit faire notre mieux d'en protéger. L'habilité ici à l'île du Prince-Édouard de sortir, faire les sports, aller au resto, et puis on a fait ça en avant et on doit en faire encore, mais j'espère que ça va pas durer longtemps, mais on ne sait pas à ce moment.
Docteur Morrison, on parle d'une suspension des voyages pour 2 semaines. Est-ce que durant cette période de 2 semaines, vous êtes particulièrement inquiète de voir une transmission communautaire arriver à l'île du Prince-Édouard? Parce qu'on le sait, la semaine dernière et même avant, des gens sont arrivés depuis la bulle atlantique à l'île du Prince-Édouard. Alors, êtes-vous inquiète pour ces 2 prochaines semaines et demandez-vous aux insulaires de faire encore plus attention pendant les 2 prochaines semaines?
Oui, Julien, exactement. Je suis un peu plus inquiète pour les 2 semaines qui suivent parce que je suis inquiète à propos des personnes qui ont peut-être voyagé la fin de la semaine, le week-end. Et alors, on demande aux insulaires qui ont fait le voyage à Nouveau-Brunswick, Nouvelle-Écosse, de porter la masque tout le temps, limiter les contacts et vraiment de faire tester s'ils ont des symptômes et s'ils ont eu s'ils ont été à certaines places à Nouvelle-Écosse ou Nouveau-Brunswick où ils ont eu des cas, aller faire tester. Parce que je suis inquiète qu'il y en a peut-être les personnes qui ne savent pas, ils ont été exposés et viennent du voyage. Alors, c'est tellement important qu'ils prennent, fait attention aux mesures de santé publique dans les prochaines 2 semaines.
Merci beaucoup.
Gabrielle Dumont, Radio-Canada.
Bonjour, Dr. Morrison. Bonjour, Premier Denny. Ma question pour Dr. Morrison en français. Je sais que le centre aujourd'hui des discussions, c'est la fin de la bulle atlantique, mais je voulais parler du vaccin, parce que vous avez mentionné tout à l'heure, Dr. Morrison, que peut-être on aurait justement un vaccin contre la COVID-19 au début du mois de janvier. Alors, comment voulez-vous qu'Ottawa, le gouvernement fédéral, fasse la distribution des vaccins contre la COVID-19 ici à l'île? Est-ce que ça va être en fonction de la population, des cas actifs? Comment vous voyez ça, la distribution des vaccins contre la COVID-19 ici à l'île?
Bonjour. Je sais que le sujet des vaccins, les groupes de priorité, la distribution sont tellement importants. Je vais en parler en plus détail peut-être demain et plus tard cette semaine, mais pour aujourd'hui, on va laisser les questions à propos le vaccin. C'est plutôt à propos de la boule atlantique qu'on veut en parler aujourd'hui, mais j'aimerais tellement répondre à votre question peut-être demain ou après-demain.
OK, parfait. Alors, je reviendrai sur ce sujet demain. Alors, et justement, là, vous avez mentionné tout à l'heure que vous êtes inquiète pour ces 2 prochaines semaines, pour les gens qui sont arrivés à l'île dans cette dernière semaine. Mais depuis vendredi dernier, le port du masque, il est obligatoire Est-ce que depuis l'entrée en vigueur de cette mesure, est-ce que vous savez si les insulaires ont bien respecté cette nouvelle consigne durant la fin de semaine ou savez-vous si des commerçants ont dû gérer des situations compliquées avec des clients durant cette fin de semaine?
Je m'excuse, je ne sais pas si j'ai compris la dernière partie de la question, mais je sais les masques sont obligatoires depuis la fin de la semaine passée. Et puis, j'entends que beaucoup de personnes en portent. Et puis, mais je remercie les gens d'en faire ça. Je pense que c'est un bon timing d'en faire les masques obligatoires. Et puis, j'espère que les gens d'ici ont porté les masques quand ils étaient au Nouveau-Brunswick et Nouvelle-Écosse. C'est obligatoire là-bas. Alors, peut-être ça va diminuer la chance d'avoir la transmission communautaire ici.
Ok, parfait. Merci beaucoup.
Wayne Thibodeau, CBC.
Yes. Good morning, Dr. Morrison, and good morning, Premier King. Dr. Morrison, I'd like to pick up on the comment you made about the concern that there may be more cases here because of the other cases in the Maritime provinces, and particularly your comment that you're concerned that it may already be here. How concerned should we be about it already being here? And if so, should there not be more restrictions placed on islanders within PEI?
Hi, Wayne. So I think we've seen some of the cases that have started to, that have happened in New Brunswick, Newfoundland, Nova Scotia. They are seeing that there may be a link. For instance, I think Newfoundland has said there have been cases linked to Halifax, and we know there's a lot of travel back and forth between our province and our neighboring provinces, particularly Nova Scotia and New Brunswick. So it does make me concerned that this is a tricky little virus, and and sometimes people are not always symptomatic. So it does make me concerned. That's why we're asking people for enhanced precautions if they have traveled, and that they should be tested if at the first sign of symptoms, and also if they've had any of the public exposures that are listed in our neighboring provinces. So it is. We certainly continue to do a great deal of testing. We're very fortunate in PEI that we have that testing capacity to do the testing. We'll continue to do the testing, and we've said right along that if we can have early identification of a case, get our arms around the case and the close contacts, then we will be in a much better position. So I guess I do know there's been travel back and forth between our provinces in the last couple of weeks, and there's always this sense that we don't want to miss any cases. So I think I'm always worried, Wayne, but I certainly think we'll know more in the next couple of weeks for sure.
Louise Martin, CBC.
Oh, hi, Dr. Morrison, and hi, Premier. I know this is not news that you wanted to deliver today, and I'll sort of maybe dig a little deeper on enforcement at the border. How will this be enforced? Is New Brunswick setting up its checkpoints again, or is there a checkpoint leaving? Just wondering how that will be changed at the border points.
Hi, Louise. I'm not sure exactly what New Brunswick and Nova Scotia are doing at their borders, but I don't believe they're setting up any change in their border measures. But certainly, we have always had people and screeners at our borders, and they're already in place, and we are going to be doing changes today. Of course, enhancing our script for the border, our screening tools for the border, and we will have additional staff at the borders to be able to help, especially as people may not have their applications in and pre-approval travel for different reasons that they might need to come to PEI. So they'll be able to help with those in those situations, especially over the next few days. So those are the things that are being put in place as we speak. We'll also are updating the website. I know there's communication support to do that. There's question and answer is going to be up on the website, which will help people. And we have some of these measures in place for the rest of Canada. So right now, it's changing it for anyone outside of PEI. So we already have some of the measures in place. As the Premier mentioned, we've done this before. But this time, I think we can do it even better because we have streams of travel for family, for compassion. We have work isolation. We have different options to make sure that people are traveling and able to get here for reasons that are important and also for work, recognizing that those are reasons that people should be traveling, but trying to protect everyone as best we can. And this is not easy, as you mentioned, Louise.
And I'll ask you both this just to get your thoughts on what the bar is for continuing. I know you mentioned this is a 2-week, temporary closure of the bubble, or PEI pulling out of the bubble for 2 weeks, and then on December 7th, sort of looking at where we're at. Can you both of you address what you'll be looking for specifically to decide whether, we're good, we can open back up to the Atlantic bubble, or we're going to continue with this?
I'll just take maybe the first part of it, and I would, to be very honest, I think when we announced the opening of the Atlantic bubble in early July, I was hopeful that the next announcement we would make would be about the expansion of the bubble, not the contraction of it. So, we don't take this decision lightly. I think we will just continue to monitor the country and the region more specifically, and to see where the trends are going, so to speak, and if we're able to sort of get a break here in the transmission along the way. As Dr. Morrison has said many, many times, the virus hasn't changed from the spring. It's just the attitudes that we have had as a community that have relaxed a little bit and has helped to sort of give life to this second wave a little bit more intensively than maybe we even anticipated. So if the measures of community change, we limit the travel, which is a big concern, the importation of this virus. We believe that will help, and I truly, truly hope it will be a short-term measure. But we'll just have to follow the public health information and follow the virus, and do everything we can to keep Islanders safe. So, Heather.
Louise, I'll just add to the Premier's comments. It will have to do with what we see in our province in terms of where our cases are coming from, how many cases. We have a number of indicators that we look at, but in terms of the Atlantic bubble, we'll also be looking at what's happening in our neighboring provinces. The reason we entered into the Atlantic bubble was that we had all our provinces had the numbers of cases really under control, and all the provinces felt comfortable at that time. And with a record number of cases in some of our neighboring provinces, certainly that's not the situation right now. So we'll be looking at what is happening in Prince Edward Island, but also what is happening in the rest of the region.
Thank you to you both. Appreciate it.
Stu Neepy, The Guardian.
Hi, good morning to you both. I guess I just have to go back to some of the basics here. So I guess under these new the rules as they exist, people can still continue to go to retail outlets, restaurants, public events. But I guess just to be clear, for both Dr. Morrison and Premier King, should people continue to go to retail, restaurant locations, go to public events, even if the guideline is also to keep your contacts small?
Hi, Stu. I think one of the reasons that we're putting these travel restrictions in place is to allow some of those activities to continue here in Prince Edward Island at this point in time, and I think that's what we're all hoping we can continue. I think there's a reason that places have operational plans in place, and that there's masks and screening and enhanced cleaning, and people shouldn't go places if they're sick. I mean, we were saying keeping your social contacts small, and but we still know that we would like people to shop if locally if they need to, but make sure they wear a mask, clean their hands, keep their distance if at all possible. And we also know that our retailers, for instance, have plans in place, and those plans really are important when we're in this kind of environment in the whole country, as the whole country is trying to manage this this virus. I don't know if you wanted to.
Look, I just say that, a big part of public safety is about public confidence, and that confidence comes from a number of different measures. I think when you go into a retail location or you go into a restaurant in PEI, there are very strict protocols that are enhanced since April. And they are very, very closely monitored, and you feel very confident in there. And I think when you add the added confidence of knowing that the interaction from our population with the rest of the country is that much more limited, I hope that gives us a little bit more confidence. But it doesn't relax in any way the need to continue to be vigilant, to follow those protocols, and to be mindful and to be careful, as Dr. Morrison has continued to say. So, we feel by taking this measure, it allows us to maintain that level that we have been at. But as we've seen throughout COVID, if the public health information indicates we need to change that, then we certainly will. But we really hope this preemptive decision that we made with the containment of our borders will allow us to avoid making those decisions now.
I think we may not always recognize PEI has been in a very fortunate position for a number of months relative to some of the other parts of the country. And so we would, this is our hope that we can maintain things as best we can within this province. But certainly it's going to be a challenge.
Okay, and I guess just as a follow, I wonder if you can just sort of go over in what circumstances someone may not be allowed entry to PEI from the other Atlantic provinces.
Very similar to what we have in place for the rest of the country, that there's a number of different streams that would mean where people can apply to come to Prince Edward Island, and that's for family reasons, for compassionate reasons. There's exceptional circumstances. It's for work. So if someone is wanting to come over here and just to shop and hang out, it's not the time of year maybe to do that, but in terms of taking a walk on the beach, that would not be, they would not have pre-approval travel to do that. And of course, the other reasons that people would not have pre-approval travel to get here would be if they are not able to submit an isolation plan. And that will continue to be important.
Thank you.
Okay.
Catherine Fleury, La Voix acadienne.
Oui, bonjour à vous deux. J'ai une question pour le Dr Morrison en français. Avez-vous déjà commencé à penser à Noël? Est-ce que la bulle atlantique pourrait, la fermeture en fait pourrait durer jusque-là et empêcher les familles de se retrouver?
Oui, Noël, ça va être difficile. On ne sait pas, mais on est déjà en train de penser. Et puis tout le pays pense à qu'est-ce qu'on doit parler à propos de Noël et les vacances. La direction que je viens de donner pendant plusieurs semaines déjà, vraiment, est qu'on doit penser de ces vacances de 2020 dans une façon différente. Et on doit limiter notre voyage partout au pays et même dans la région. Alors, à ce moment, si vous voulez voyager pour à Noël, on ne sait pas si à la boule atlantique, la suspension va durer jusqu'à ce bout de temps, mais à ce moment, on ne veut pas que personne fait des grands plans de voyager n'importe où. Mais si vous voyagez, doit penser si vous pouvez isoler pendant les 2 semaines. Mais on ne sait pas maintenant à propos de Noël. On va voir dans les 2 prochaines semaines.
C'est parfait, merci.
Dave Stewart, The Guardian.
Good morning, Dr. Morrison and Premier King. Just wondering, with the heightened concern that is obviously in the community, one of the reasons why we're talking here today, has there been any consideration given to limiting visitors once again in seniors' home visits?
So we have a meeting at lunch with long-term care. There's already, we had put in place changes in terms of the visitation to only have so many visitors allowed in a designated space as opposed to having any visitor in any room. So that had already been discussed with long-term care, private and public, last week. So I think there'll be further discussion today. Some of the homes already have made some changes in terms of visitors and the restriction of visitors. So we're just trying to make sure that all our private and public facilities are on board and are aware, and those changes to the long-term care directive will likely be finalized today as well.
Thank you. And I guess my follow-up would be, I know now that masks are mandatory. Has there been any consideration in terms of I don't know, maybe this question's for Premier King, low-income islanders? I mean, this can be an expensive endeavor for islanders. Now that they're mandatory, is there any consideration to handing them out? Something to reach out to low-income islanders.
Yeah, thanks, Dave. And that is always an issue that we try to deal with. I know I didn't move around too much this weekend, but a number of places that I did go into briefly, I do see there's an offering of a mask that is there. I mean, I think we would just need to continue, and maybe Dr. Morrison could help us or with this, but also maybe the Ministry of Health and Wellness. But I don't think the provision of a mask is a big undertaking for us. So we would probably work with that department and with Social Development and Housing, et cetera, to make available the masks to those who need them. I wouldn't want the affordability of a mask to be a determining factor here. I think that PPE was in short supply at the beginning of the pandemic. I think that's changed dramatically now, and so masks, I believe, are readily available here. And we would. I appreciate you bringing it up, because it's probably a good idea for us, if we haven't, to touch base with those who work on a day-to-day basis with our low-income islanders, and make sure that they too are protected and help protect each of us.
Thank you very much.
All right, well, thank you very much, everyone. I appreciate the questions as always, and enjoy the rest of your day.